Michael Thompson has spent half a century working as a surgeon for the NHS. He's witnessed some major changes in his field, and at 73, he still takes care of patients in Portsmouth. Our reporter Nicole Ris has more.
It's a special anniversary for Michael Thompson. 50 years ago, he started his career as a surgeon for the NHS, and although he could enjoy his retirement, he still offers his services as a consultant at Queen Alexandra Hospital.
I get up at sort of 7:45, drive my car into QA after getting my wife breakfast and toast and things. And then I see about 9 new patients. I only see new patients, mainly with symptoms of bowel cancer. And the aim is to, as most of them don't have bowel cancer, is to reassure them and then decide whether they need any more tests. And I really enjoy that, partly because we've collected this data now for since 1986, and we've used this data for all sorts of things, including now we built an online symptom checker for bowel cancer symptoms, which is now on NHS Choices, and it gets something like 1,000 hits a day, or over 300,000 a year.
Throughout his career, Michael has witnessed many advances in medical care.
I think one of the most exciting for me is the way surgical care is delivered. Obviously I'm a surgeon, and in particular how it's much simpler, it's less painful, people get better quicker, and it's a whole series of changes from when I started. For instance, people who had a simple hernia operation were kept in hospital for a week. And when I arrived, I pretty well quickly changed that, so it was a day case. But we even do pile operations as day cases. Patients still get a lot of pain, but at least they can go home and be miserable at home. But the big thing, of course, is keyhole surgery, which was coming in as I retired, in fact, which has made a huge difference, that patients have less pain, they're in hospital for less long, and actually, probably, the operations are made a little bit safer. And so the care that people get now, in some ways, as you know, in the health service is really struggling, and a lot of people are suffering. But the care that people get with bowel cancer, for instance, is unbelievably good.
Of course, Michael has enjoyed many career highlights.
The thing that keeps a surgeon going is the fact you have a skill which can help some people. And often surgeons, I think, are praised for that or over praised for something which for them is fairly simple. In my discipline, which is operations on the colon, which are difficult and patients don't always do well because of infections and things. But even that I used to enjoy, because you'd go in knowing that you'd actually come away. Patients don't always get better even if you've done all the right things, which is the downside of it, but mostly they did. So I think there have been many highlights, but having said that, particularly as you get to my age, you can look back on your life. I think the highlights have been with my own kids and my family, even though I've loved my job, and if they watch this, they'll laugh, because obviously I've been very busy with that, perhaps not always been there when I should have been, but I've been lucky to have a fantastic family, very loving wife who has put up with me, and together with a fantastic job. So it's difficult for me to compare the two.
Nicole Ris for That's Solent.